Good evening, all, and welcome to The Freedom Advocate, an online blog dedicated to the advocacy and fight against human trafficking around the world. Tonight, attention is directed towards the people who most of the time are among the first to interact with victims after they have escaped or been rescued, and many times are the rescuers themselves. Of course, I am talking about nurses, paramedics, and other medical professionals who care for human trafficking survivors after the fact. Tonight, we are joined remotely by Anna Satterley. Anna is a graduate of the nursing program at Vanderbilt University and originally from Macon, Georgia, and is now a nurse practitioner at a premier hospital in New York City. She has agreed to speak with us tonight regarding recognizing and addressing the needs of sex trafficking victims. Anna, thank you for joining us.
Thank you, Kat, for having me.
Anna, to start off, since New York City is such a large metropolitan area within the United States, and according to recent statistics, the second largest state in sex trafficking reports out of the U.S., do nurses and other medical professionals in the city receive additional training or education regarding identifying, caring for, and meeting the needs of survivors and or victims?
Oddly enough, no. There's no specific training my coworkers and I have done for this issue aside from red flags to look out for and potential victims. I'm not sure about other hospitals and organizations in New York, though I would be surprised if my hospital was different than the others. For something that's such a widespread and growing issue, I'm surprised that more hospitals, especially in a major metropolitan area, do not allocate resources towards special training regarding this topic.
That's very unfortunate to hear, and I'm glad you recognize that it's something that's needed. Have you come across patients who have encountered this nightmare before?
Unfortunately, Kat, I have on multiple occasions, and to be honest, it still keeps me up at night. Men, women, and even children, as you know, can all be victims of human sex trafficking. And I have had to treat so many that it adds to my concern that us nurses, on top of EMTs, doctors, and other hospital staff, are not well equipped to meet the needs and properly care for individuals escaping the situation. It's much more prevalent than people realize, to a horrifying degree, especially in a major city like New York.
So tell me, what is the protocol when you encounter a victim of human trafficking as a nurse practitioner?
Well, it could go one of two ways. If it is a person we suspect is being trafficked and we need to intervene, we will separate them from the person accompanying them to the hospital and attempt to receive a signal of help from the patient that allows us to give more information to the police. If that is not possible, we will have the police or security intervene however they see fit. The safety of the patient is our number one concern. However, it is especially challenging when dealing with individuals who are not American citizens, since we cannot make as many promises or offer them as much protection usually. And by we, I mean police, security, all of that, but we're a big part of it. And then as far as individuals who have already escaped and are being treated, we will always do a full panel testing for any and all traceable sexually transmitted diseases, as well as treat any other injuries or physical trauma the patient has suffered. A rape kit will also be conducted if we feel that one could be helpful in an investigation. For female patients, we will always test for pregnancy and provide the patient with their options if the pregnancy results test positive. Then, if not already, the authorities will attempt to contact whatever family can be found. However, unfortunately for many, this is very up in the air depending on where they came from or how long they have been a victim. Children are turned over to family services and others, it depends.
And how about psychological treatment?
So, unfortunately, psychological treatment is only provided by my hospital, in particular if the patient is displaying signs of a psychological disorder such as schizophrenia or borderline personality disorder. This is the thing that I believe should be changed the most, as obviously these survivors are in need of significant psychological therapy and help, and oftentimes will be unable to access it themselves once they leave our care. I believe a full psych evaluation should be done on each patient, and unfortunately, though many hospitals will claim it is part of the protocol, oftentimes due to shortages, it is not. It really upsets me in a lot of ways because we have such an amazing psychological department at my hospital, and I am very upset when it is not used to its full potential when assessing and treating a victim of sex trafficking.
Aside from offering better psychological help after the fact, how do you believe a hospital could better provide for victims and survivors?
I believe every doctor, nurse, and any other first responder or medical faculty should have to take training to educate themselves on sex trafficking facts, statistics, and how to best serve the patients via advice of other survivors.
They know best as to what another survivor would need in that situation, better than someone like me or another medical professional. We are trained to what to look out for, but once we encounter an actual victim or survivor, we're thrown into the deep end and we're forced to treat them like any other patient, which makes sense in a way, but also they need so much more care, consideration, and attention coming out of their situation that I feel that more training definitely needs to be added to the curriculum for anyone training to be in the medical field. Thank you, Anna, for taking the time and speaking with us and addressing your concerns as a medical professional.
Thank you, Kat, for having me.
Thank you all for tuning into this interview. I am grateful Anna could carve time out of her schedule to talk about such an important issue and bring more awareness to our, as a country's, hospitals' lack of training and resources to their staff regarding sex trafficking victims and survivors. And as always, the number for the National Human Trafficking Hotline is in the description below. There is help available 24/7 in English and in Espanol by calling 888-373-7888 or texting the word info to 233-733. Remember, if you see something, say something. With the report tonight, my name is Kat. Thank you all for tuning into the Freedom Advocate. Good night.